What is up, Rehab to Performance podcast listeners? Today we have another special guest on the show, somebody who I think is one of the most underrated thinkers in the profession, Dr. Jeff Cubos. Dr. Cubos practices as a sports chiropractor just outside of Edmonton, Alberta, working with Team Canada athletes in this past Olympics, the Edmonton Oilers, and local junior hockey teams. Dr. Cubos has published multiple papers focusing on concussions in youth hockey and additionally has a blog where he posts rehab course seminar reviews. Welcome to the show, Dr. Kubos. How are we doing?
I appreciate. I'm good. I'm good. Thank you. I appreciate it. Thank you.
You
I
betcha.
don't do this. I don't do this often, for several reasons, but it's nice to do it once in a while.
You betcha. It's tough to find you. So if we get rolling here, just take us through your background leading up to going to chiropractic school, and I guess what was the moment you knew working with high performance athletes and even Olympians was sort of your path?
Yeah, I think I could answer that pretty simply. Um, so I started off. I'm originally from Toronto, born and raised in Toronto, and went to the University of Toronto in the Phys Ed and Health or kinesiology program. And as part of the requirements for that program, you would have to do volunteer placements in order to get credits. And so in my third year or my junior year, whatever you want to call it, based on Canadian or American, I did placements with track and field and baseball. And then in my fourth year, I continued on with track and field, as well as did a clinical placement with a chiropractor. Now, at the time, at the beginning of that year, I had interest in sport medicine. Wasn't exactly sure what I wanted to do. Had never seen a chiropractor, but was exposed to athletic therapy or athletic training. I was exposed to physiotherapy, and I knew that chiropractic existed. So what I did was I just applied to all three schools or all three programs. Um, as I followed through with this one clinical placement with the chiropractor, he so happened to be the Toronto Raptors chiropractor at the time, as well as was heavily involved in the hockey world and treated a lot of hockey players in clinics. So in the end, I realized that this was fun, and I ended up dropping my athletic training, athletic therapy, and my physical therapy applications to those schools, and just kept up with the chiropractic one. And from that point on, that's what I knew. I still wasn't familiar with, you know, chiro as a whole, but I knew that I liked how he practiced. I liked that he was working with athletes. And then even after I got in to chiropractic college in Toronto, I still um, shadowed and mentored under him as often as I could, as I did with track and field. But I will say that my first ever mentor was a massage therapist who has a wealth of experience, still practicing today, and is a great sports massage therapist. So yeah, that's how I knew I wanted to do it.
Cool.
So I kind of want to get into, I read that your post-grad residency was focused on research on concussions. Is that right?
Sure, sure.
Yeah.
Yeah.
So I was wondering, like, did that kind of directly or indirectly shape like how you think about like brain health and then your protocol today? Like how has that kind of changed over the years?
Admittedly, that was never a passion of mine,
Mm,
concussions or brain health. Um, Logistically, how it went about was after chiropractic college, um, I wanted to do my sports residency and become a sports fellow, which is the equivalent of a diplomate in sports in the US. And this program, you can do it in several ways, one of which being within the Canadian Memorial Chiropractic College, of which I was not admitted. I wasn't accepted. And so I did it through York University, uh, through the master's program. And during my master's program, it just so happened that my supervisor was involved in a large scale, actually, my co-supervisors were involved in a large scale uh, research program around concussions, head impacts, head injuries, so on and so forth, with about 5 different universities, a couple of which were in the US as well. And so, truth be told, I just piggybacked onto that and figured out a research study to study myself, because we were all the my supervisors and their graduate students were already collecting data. So I just jumped on and created a research question myself and went with it. So do I have a special interest in it? Admittedly, no. Um, do I try to stay on top of concussions and brain health? Absolutely. Uh, but at the same time, um, I'm not certainly not as deep into the material as I was during my graduate program.
Are you still doing like any types of treatment for concussion protocol, or because I know I've been seeing a lot of things like recently, like creatine has kind of exploded as like
Sure.
a TBI supplement to help, post concussion. Have you had like any like big changes, or are you still treating concussions with what you do now?
Yeah, I mean it's obviously it obviously differs. If I'm in clinical practice, which I am with I my wife and I, we have a clinic with several associates. Um, and so how I would manage an athlete or a person with a concussion there is certainly different than how we would manage an athlete with a concussion in professional sport. And not to get into specific details, other than the fact that we're seeing the athlete every single day. We see the professional athlete every single day, whereas, as everybody knows, in clinical practice, how many patients come to the clinic every single day for the duration of their entire injury? It's not many, if at all. So yeah, there are certainly some differences as opposed to the with respect to the creatine. Um, I will say this, and this is nothing to do with concussion, but when we have our game nights, I myself will load up on creatine, because I know I'm going to bed at 1 a.m. and I have to get up at 6. So, or if we're traveling, I will load up on creatine, and I have found that since I've done that, my again, subjective and maybe partially objective because I use my Aura ring, my recovery scores have been better. So I will say there is something there. Um, I mean, just like red light, can you truly pinpoint um, what exactly it's doing? Unless you're a scientist, probably not. But if people feel like they're recovering faster and the harm is minimal, if at all, then I'd say why not?
Maybe to piggyback off of that answer, how do you think you management the relationship between, at least on the professional level, between teams, medical staff, strength coaches, athletes themselves, when everyone has a different agenda? Like in the RTP space, we obviously talk a lot about function, getting patients moving. So I guess how do you stay in your own lane as a sports chiropractor when there's other members of the athletic or medical staff, if that makes sense?
The first thing I would say is what I learned early on, fortunately, has become I guess a phrase or a motto that I don't want to say live by, but I work by. And that is, when you're working in a team setting, especially if you are new to a team setting, I don't care if it's a professional sport or, junior sport or even a community sport. Like if you're new to the team, I don't want to say you guys personally, but what I personally have found that is probably a good idea is these words: be available, but get out of the way. Because unless it is an absolutely new expansion team, it has already existed without you and can exist without you. So I think the wise thing to do is be as available as you can, but get out of the way because stuff is happening. Um, in terms of your question, though, you use the word agenda. And I would say if there are agendas, I think no matter how hard you try, that would make it quite difficult. You have to really truly be on the same page. And um, fortunately, we have 6 medical providers on our medical staff with the Oilers. We have 3 athletic therapists. We have a physical physiotherapist, a massage therapist, myself. Then we have 3 strength coaches. And I would say that yes, in large part, several of us, if not most of us, we all come from different professions. Um, we also think alike as well. We know what each other's thinking. We know what each other will be thinking. Uh, but at the same time, we also have our individual nuances. So think of it, I guess, like 80-20. 80% of what we do, whether it's a strength coach, a physiotherapist, myself, 80% of what we do is probably very, very similar to each other. And then the 20% is where we each differ. So, for example, myself with adjusting, several of us with acupuncture and needling, a few of the other guys with their taping skills, obviously the strength coaches with their program design and their coaching skills. I would say the key is not to have an agenda. And I think over time, again, it's easier said than done, but over time, you truly have to be on the same page. And I guess that starts with leadership. So we have good leaders, and we also meet every single morning. So it's hard to not be on the same page.
Hmm. Communication's key.
Yeah, yeah, yeah.
Um, I know a lot of Canadians listening to this are probably wondering about some Oilers hockey stories, but without going into any, proprietary stuff, we've seen you on the bench during Oilers playoffs games, working on playoff or players. What goes through your mind when you have a player that's in pain and you have to deal with them sort of in split second decisions?
Um, I'll tell you what went in my mind, what went through my mind early on when I first started with the team was, is it something that I should be taking care of? Or is it something that someone else would be better taking care of? Because obviously in clinical practice, it's just you for the most part. You have your, coworkers that you work with. Um, but in such a fast-paced, dynamic environment of pro sport, you also have, you know, in addition to the five, 6 of us that I mentioned, you also have 4 doctors on staff every single game. So, someone has pain or injury. I mean, the reality is it probably does go to our head guys first. Um, and even still, if they do come to me, in the back of my mind, throwing the ego out the door, it's like, okay, I I am doing what I'm doing. I'm assessing what I'm assessing, but even still, am I the best person for this athlete? Um, at this given moment of time in time. Sometimes it is me, and sometimes it's not. So I think maybe it's a skill or maybe it's experience that you have to recognize when it is your turn and when it's not your turn. So what goes through my mind is that it's also what can I do to I mean in that setting of a team sport, it's if the objective is to get back out there, what can I do to get them back out there? And then again, it goes hand in hand with, okay, well, doc, you know, is this person at risk, or so and so is this person a liability either as well? Um, But at the end of the day, I don't think it's what from a clinical perspective, I don't think what goes through my mind is much different than what happens in clinical practice, other than maybe the speed and timing of which it happens. Um, I mean, a lot of times you're going by your experiences, and you got to trust your experiences.
Hmm. Yeah, that makes
Yeah.
sense. Well, good thing you got creatine in the system to get you through that.
I got it in my system, that's for sure.
I kind of want to segue since you mentioned clinical practice there as well. If you have somebody that is like wanting to run this kind of rehab to performance style clinical practice, either in Canada, maybe the States as well, but having like a shorter appointment time, um, how do you kind of focus on how many patients you're going to see per day while, still keeping the doors open, like being financially stable? Do you see that as a challenge at all, or?
I, I see what the biggest challenge here's what I see. I see people wanting to practice how obviously how they want to practice, or how they think they should be practicing, or how their peers practice. And dare I say, the trend these days is practice out of a gym-like setting. I think that's common. It's shiny. When you're doing your social media, you have a lot of stuff in the background, that's for sure. Uh, but what I will say is this: none of that matters if it doesn't matter to your patient base and to your community. So the reality is, a lot of patients that come through the door, uh, a lot of them, their goal is just to be able to get back to doing the things they love and want to do. So, uh, you know that they can withstand pain if it's not interfering with work or interfering with taking their kids to wherever. But once it interferes with their ability to do that, then their pain becomes pain. So what I'm trying to get at is, I think what some people fail to see, and this is again, this is just my observations. I think what some people fail to see is what truly matters, is what the community that you are working in, that someone is working in, and the patients that they're working for, what are their goals and interests? So for example, my wife and I, we bought our clinic in 2009. Prior to that, I had been practicing for 3 years, as well as doing my residency program and my master's, both of which were in gym settings. That's what I wanted. Okay. But we bought an activator practice, high volume activator practice. And we're like, this was a great opportunity for us. We're moving across the country. It's an activator practice. We know nothing about activator. That's fine, because that's not going to be what our practice is going to turn out to in the end. But we had a patient base. So we also had no money to buy any equipment, let alone, kind of like what sometimes you learn in school, even modalities. Um, we had no money left over for that. All we had, um, the ability to purchase was maybe more headrest paper if we needed it. So anyway, I turned one of the rooms, took a table out, turned one of the rooms into a rehab room, and all we had was maybe a Swiss ball and a foam roller and a mat and a couple bands. And that was a blessing in disguise, because at the same time, mentored by and influenced by the likes of, you know, Dr. Liebenson and Charlie Weingroff and anyone and everyone in that time and space, I was forced to just get better with what I had, which were my hands, the floor, and creativity. So, so in terms of um, working in rehab settings that are gyms, for example, I know a lot of people want to do that. Um, I will say that going back to my original statement, I know I'm going off on a tangent, but um, most people don't have that equipment at home. And yes, I have the luxury of having all of that in the professional athlete setting that I work in, but in a clinical setting, a lot of the patients that come in, they just want to get back to what they want to do and what they love doing. And if it means doing floor-based exercises that get them the same internal and external load as something that we would traditionally see in the gym, but they can actually do it at home, then you win. And I think clinicians will be a lot better skilled if they constrain themselves and limit what they have at first and are forced to use creativity and develop creativity. Um, yeah, I think that will help them in the end. So
To,
it's a long-winded answer. I would say though, social media is both a great thing, and as we all know, FOMO does exist. And unfortunately, I I grew up professionally uh, in a realm where social media was only conducive to learning and had nothing to do with marketing.
That was
So
a
I
great
just
answer, Jeff.
that's cool.
I wish for that. I wish that for new grads that they didn't have to think about marketing, because the more you think about just getting better, that's all the marketing, you know, you will largely need.
hmm To piggyback off of Richard's question, I think a lot of the specifically Canadian students, but really all the students who want to practice in an R2P like way, they're like, hey, I'm going back to this clinic in whatever state or province. We have 15-minute appointments, maybe even 10-minute appointments. I want to do all this movement-based stuff. I want to do this DNS stuff. I want to, use FMS type movement. But these patients are coming in and, they just want to be adjusted.
Sure.
How do you, at least in, a setting like yours, balance those two things, as in the adjustment maybe sometimes being what is helping, but sometimes being that carrot that we need to dangle for the patients. um, how do we balance still getting enough movement or active based care in that smaller visit Canadian type setting? If that makes sense.
Yeah, 100%. And I'm going to go through a long answer to get to that.
For sure.
So another long answer. I do appreciate and understand that in order for someone to truly um, become an expert or a specialist or very, very proficient in a technique or a system, they have to follow it to a T. So whether it be SFMA, DNS, you have to go down those rabbit holes, pick those systems apart, do everything they tell you, and only then can you eventually break those rules. Um, would you somewhat agree with me on that?
Of course, for sure.
Because I think if you go to those courses and only take away, what you think resonates with you, I don't think you understand it.
hmm
I think you really truly have to pick it apart. So yes, I get that, Monday morning after you take a course, after you go from, again, DNSA to B to C, you you almost be a disciple, if you will, for a short period of time, and you just do what they say, you follow it, you study it, um, and then eventually maybe you have the privilege of taking shortcuts or molding it to how you think it resonates with you. Because at the end of the day, if you're unless you're only taking the one system, you shouldn't practice how someone who only does that practices, because you have all these other systems that you've learned from. And at the end of the day, really, they're not really teaching you their protocols. They're teaching you how they think the human body works. So when you've taken 5 different systems, those 5 systems have influenced how you now think the human body works. So if we kind of start to move forward toward your question, um, and we've gotten past the point of following their protocols, if someone has a 15-minute, a 20-minute, or even if they're lucky, a 30-minute appointment, you will eventually find that certain things are more important at that given time than at other times. So here's an example. Someone comes to me today, and I'm going to assess and maybe reassess through movement, through potentially orthopedic testing, 100% through their history taking, because I think that's the most valuable of all of it.
For sure.
And then I will identify in my mind, whether I realize it or not, what is most important for that given day. And then I will provide what I think is necessary based on what I think is important for that given day. And oftentimes it's 1 or 2 exercises. Oftentimes it's some type of hands-on technique, whether it be an adjustment or soft tissue or whatever. Other times it might have some acupuncture and needling in it. And then let's say we conclude that session, and let's say I see them next week. I will reevaluate, reassess. All of this is happening in real time. And then I will find out what's the most important thing for that given moment on that given day. And if you follow that process in terms of the mindset that every single day is different from the last, which is different from the next, then you'll identify the most important things you need to do for that person. And sometimes it is an adjustment or two. Sometimes, I would say often it is some type of soft tissue, and also often it is some type of exercise. And the goal is always to be progressing the exercise. So uh, you cannot progress unless you're reevaluating, unless you're looking at the exercise, unless you're asking how they're feeling. And, you know, you might tweak a dead bug or a 3-month position in a very, very minimal way. But if it's closer to 1 step closer to how they are and how they're progressing at that given moment, then you won. So, the assess and reassess, the clinical audit process is something that, you know, that's the first time I've thought about that phrase in probably close to 10 years, but I do it every single day. I do it every single day. Um, so amongst all of what I just said, you also need to be confident. And I understand that that comes with time and experience, because if a patient is going to push back and say, I just want to be adjusted, like you have to be the doctor and say that, and be comfortable saying, especially in an acute low back, or a very, very chronic biopsychosocial low back, those are probably the 2 times you probably don't want to adjust them, and you have to be confident in your reasoning. Uh, my easy answer is often that I've made the mistake of, you know, putting someone in a position where they can't walk out afterwards
Mm-hmm.
because I've adjusted them. So, but I will say, through a clinical audit process, if you're going through the steps and you put them in certain exercises and you recheck and they feel better, it's like, well, there's your answer. And they're like, oh, aha. Again, it's not that easy sometimes. Uh, but I would say if you're always doing things with intent, um, things start coming to you. And I will say it is possible to practice in an R2P type setting, uh, in a 15-minute to 30-minute appointment time slots, because eventually you're not following every single protocol, like I said earlier, because you've graduated from those stages. You are skilled enough that you have blended potentially all the different systems into a philosophy or a thought process that you've come up with yourself, whether you realize it or not, in terms of how the human body and human person function, that you will be able to find um, a system that can work well and, dare I say, be profitable. Um, Reminding yourself that people like being touched.
Hmm.
It's human nature. When you're consoling someone, you put your hand on their shoulder or their trap. Like, it's so to I know some people have absolutely gone against manual therapy, but people like being touched.
Hmm. Yeah,
So
so much of the visit is, saying the patient's name, greeting them with a warm smile,
100%.
therapeutic touch. Exactly. No, I love that
Yeah.
answer.
Yeah.
Yeah.
Um, Kind of want to go back to, I know you talked about like your first introduction was working with the Toronto Raptors, Cairo.
Sure.
Um, if you had somebody that was looking to get into sports and like working with a sports team or some sort of like a high performance um type of athlete, what do you think the segue is and like how did you get into it? And then if you had like a student that was wanting to get into it, like someone from our generation that is about to graduate, what do you think like the
Mhm.
steps they need to be taking to get into that realm?
Let me preface it by saying I am blinded by my own steps. So, meaning, sorry, not blinded. I'm what's the word I'm looking for? I'm
Survivorship bias?
shaped. Yes, sure, survivorship bias, or I'm shaped by the steps that I took. So when I was in undergrad, I was already doing my placements as a student therapist. When I went into chiropractic college, I was already working with minor hockey teams, studying during practice in the penalty box for, as we all know, upwards to 14 exams in a 2-week period, right? So I was a student, being a student therapist, getting my hands dirty, getting as much experience as I can. Um, and then even upon graduation, any and every opportunity I could to assist and volunteer, uh, and work with athletes of all uh, different sports, as long as I had the time. Um, Meaning, like, there was no such thing as weekends because that's what you're doing. Um, then I would do it. And so I hate to say it, but I'll get every now and then a DM saying that, is there any opportunity to shadow with the Edmonton Oilers? And there's pretty much nothing on their resume. And like, so it's a tit for tat world. Like, what are you giving to the team if you don't have any experience, even at any level? So I think personally, yes, some people get lucky. There are colleagues of mine who just graduated and 2 years later they're at the Olympics. I didn't take that route. It took me 20 years to get the Olympics. But I'm proud of my steps because, you know, working in minor hockey gave me the experience necessary to work in junior A hockey, which gave me the experience to work at international, and national level track and field, gymnastics, so on and so forth, which also gave me experience to work at other levels of junior A hockey, which then led to working with my first professional athlete, professional hockey player independently, who then hockey players talk, locker room talk, and they start to refer each other. And it's like the sniff test, or if it walks like a duck, is, like they can tell you apart from the next person, and if you have what it takes. And if you don't have that experience, they won't come back. So um, nothing will substitute for getting your hands dirty, getting that experience, uh, and so that when you finally get to the place where you truly want to get to, that you're so comfortable that you're not in awe of where you are. So, case in point, within the first few days at the Olympics, I noticed that this was exactly like my experience in 2017 and 2018 or 19 at the World University Games, where it's a global event, extremely large, thousands of athletes of all countries, all sports. The only difference this time at the Olympics was the Olympic rings on the walls. And I wasn't in awe. Yes, it's the pinnacle of sport. Um, and I know that might sound a certain way, but I would say I was quite comfortable um, because I've been in those situations. I've been in enough situations that um, then I can perform and not worry about the stress of going down 1-3 and risk not even making to the playoff rounds. So um, again, like even with even when you go to, whether you're a new grad or in school and you're trading treatments with someone else, there are some people, some friends that you would rather get treated than other friends because you know that some people have what it takes and other people don't. And the only way to get what it takes is by getting your hands dirty. So I would say, if students want to get there, it's um, get as much experience as you can. Uh, dare I say, work in a high volume clinic because, you know, if someone freshly graduates and sees 2 patients a week, um, it's hard to get better that way. You know, again, dare I say, someone might be in the setting that they want to practice in a gym with personal trainers and all the equipment, and they're seeing 2 patients a week, and they're making 5 videos a week to post on social media, but they're truly not seeing patients. Patients can tell. So so I would say is, while someone might be building that style of practice that they want to practice, if there's an opportunity to get in a busy clinic and maybe not treat how you want to practice at that moment, I still think there's a lot of value because you're probably working with other people who have been there, done that, and maybe they have a different philosophy, but you're still guaranteed to learn something.
Hmm.
Great answer,
I love
Jeff.
that. To touch on sort of that journey, like throughout your career, continuously learning. You posted continuously on your website, jeffcubos.com, for quite a number of years on just like random thoughts or
Sure.
CE reviews. So it's been super cool going back to when you first started posting and seeing the progression of your own thoughts as this world of the rehab chiropractor has developed since then. So I wanted to ask how your practice itself has been shaped and changed since when you first started posting there in 2009 and throughout the years till now, at least in a private setting.
Yeah. That's an interesting question. Uh, because I would say along the way, year after year, there aren't glaring differences. I would say, you know, if we ignore the fact that we first took over an activator, let's just ignore my first 3 years of practice, because I was still in school at the same time. And let's start with moving to Alberta. We bought this practice. We had no equipment. Um, we were getting the tail end of the turnover of the practice that we had purchased from the prior owners, who were seeing maybe the 3 to 5 patients per 15 minutes. So I would say it started off with, you know, number one, do no harm and make sure you're not missing anything. So you get really skilled at asking good questions if you're doing it with intent. Number two, I found out that they really didn't have but wanted some type of soft tissue therapy, and they didn't realize they needed exercise rehab. But once they realized that that stuff gets you better faster, then sure, they wanted it. So now fast forward all over the years till now, I would say the things that probably change the most that I can identify is I probably get to certain areas a little bit faster, and I'm more confident in, I don't want to say skipping steps, but becoming more efficient with my exercise identification and prescription. Um, and what I will also say was there was a short period of time where I did fall into the trap of exercise, exercise, exercise. Manual work isn't good, because some people were touting that, and I kind of got influenced a little bit. But then, thankfully, um, just doing things with intent, you realize that if you do it the right way, it can speed up their recovery process. And so, if you can get the joints to move better and more efficiently and have better afferent input from the outside world, it will transition to a better efferent output again to the outside world, and better function, hopefully less pain. Um, but to answer your question, I would say the things that I do probably different now than I did back then was, knock on wood, but I think my questioning is on point. Um, I really, really put the most priority in that conversation, in that history taking, in that communication, in that um, really truly getting to know the person in front of you and getting the story of why they're in there. That's number one. I would say my hands-on assessment skills have evolved, and to complement my movement assessment, I think sometimes we get into the trap of over movement assessing and actually not getting our hands in. We're chiropractors. I mean, and some of us are physiotherapists. Sure, I get that. But you can tell when a joint is optimal, and you can tell when it's not, and often it's not. And if it takes 2 seconds to get that joint and its surrounding tissues to move a little bit better, then the exercises that you're going to prescribe will be way more effective. So, yeah, my communication, my hands-on assessing skills, start with MPI. If, maybe some people don't realize that, MPI and R2P can coexist, but they
Absolutely.
100% do. So, you're actually, while I'm on that note, learn from other people that aren't even in our profession. So osteopaths, and I mean the true osteopaths, not the ones that just take the 1 year course. Massage therapists, those guys have their hands on for the full hour, 6 hours straight. Like they know what they're feeling. And then obviously physiotherapists and athletic trainers, athletic therapists, and anyone and everyone. I find that we we often, without even realizing it, stay in our own bubble and um, are confident in what we know, but don't even realize there's so much we don't know. Uh, and I would dare I say, if so and so who practices on the other side of the world, who is of a different profession, can get the exact same type of patient better with a different technique and strategy than we do, then what can I learn from them? Because they're obviously doing something right as well. So, um, yeah, I would say history taking, hands-on, um, manual assessments, movement assessments. Yeah, those evolve over time. And then even my confidence is also what is still growing. Uh, but I think it's, you know, especially when someone's in pain, they really want you to be their decision maker. And I get that it's a two-way street, but they're coming to you for expert advice, opinion, and treatment. And if we're not taking charge, they'll find someone who will, and hopefully it's someone who actually knows what they're doing and is doing something that you agree with, because that certainly sucks is if they leave you and go see someone else and you're like, okay, well, yeah, they're doing shockwave for plantar fascia. And sure, there's some research on that, but you can get them better, faster, and longer with your hands-on skills and your exercises. But someone sold them on shockwave because they had more confidence in terms of what they were speaking. Like, yeah. So again, you can't fake it. You just have to earn it and deserve it. So, yeah.
Hmm. One more point, speaking upon that in terms of movement assessment, I think it's just top of mind, having gone through the FMS quick screen stuff that has come out and SFMA stuff that has gone out. Do you still use any of the functional movement systems type stuff? Or what does your movement assessment look like, if you don't mind speaking upon that?
Um, I know that those assessments and screens have evolved over time. And I will fully admit that I'm not up to date with the current iteration. Uh, but in clinical practice, most of the time, my movement assessment stuff starts off with a top tier
Hmm.
SFMA, and we'll branch off um, depending on where that algorithm and my algorithm in my head leads me to. And yes, I'm not following the protocol anymore, and yes, I'm not up to date, but I'm okay with that because I also have other systems that I've learned over time. And I would say I've also seen a bunch of things over time that it's led me to what I would say is comfortable paths to take to find what is most relevant. So, um, could I use a refresher in what they're doing? 100% I can. Uh, but again, to answer your question, it starts off with the top tier and then transitions to a mix of, again, it depends on what's in front of me and what they're coming in with based on my history taking. I'll start off at the top tier, but if someone is having a chronic 2 to 20 year presentation, then I might cut to the chase and just get them on the floor and watch how they move and start talking to them. And never end up getting them on the table, at least for the first while. And then if someone is, let's say a soccer player, for example, I might follow that top tier a little bit more and know that with soccer, it's trunk, hip, and core. And so I might integrate some of the DNS stuff in there. I might integrate some of, Alison Grimaldi from Australia, some of her tests. And so I'm okay cutting corners and not following the protocols because I know that I had followed the protocols before, of each of these systems, and now I've developed it into what I'm most comfortable with. And again, it's always driven by my questioning when they first come in, that given day, and where I feel based on those questions and the history taking where I need to proceed to. So sometimes it's, yeah, just jump straight on the table and I'm gonna check passively how someone is moving, or I might do some strength tests, or I might do some movement tests. Goes back to what I said earlier. It depends, but it's okay that it depends because I know that my personal system led me to those different spots at that given moment based on my questioning with intent.
Cool.
So, versus the, hey, how are you? Okay, now jump on the table. No, it never works. It's never like that.
So one thing that me and Griffin have heard or seen, you've been kind of termed as the quiet leader in human performance at rehab. Um, so do you think
Really?
that
Even though I rant a lot?
Quiet on
hey,
quiet.
you rant when needed, so these explanations have been great and it really ties in well. But
Sure.
um do you think that some of the best practitioners out there are usually the ones that are like kind of flying below the radar? And do you think it's kind of intentional for their style, or how do you think it kind of plays into that? And also, since you are the quiet leader, do you think you would ever intend on teaching anything?
Um, your first question, I would say no, I don't think the good ones are always the quiet ones, because I would say as much as, let's take social media, for example, as much as we are inundated with certain experts and certain, um, I don't want to use the term influencer, but the more popular individuals that are out there and have high followings and actually put out good stuff. Um, I still think that's a very, very small subset of our profession. And when I say our profession, I mean collectively in the musculoskeletal world of physical therapists, chiropractors, athletic trainers, massage therapists, everyone else, medical doctors, osteopaths. The ones that we see on our feeds, the ones that we see at the conferences, the ones that we see on the teaching circuit, it's still a small subset. And I guarantee you go to a rural community and speak with someone who's 35 years in practice. Sure, they might not be a teacher or instructor per se, but we will have a lot to learn from them. So I would probably shift the mindset from so and so are leaders to a lot of people have stuff to offer, maybe in small subsets in small realms, but that's okay. Like, because even the instructors, a hip expert, that's still a small realm in the grand scheme of things. But um, so I don't think leaders have to be very vocal and outright, and I also don't think that they're also quiet either. I just think some people spend, um, and kudos to them, spend more time, and it's higher up on their priority list to be seen, on the teaching circuit, and they supplement their income through through teaching and through conferences, and then maybe that's what they're more comfortable with. That's okay. And other people are more comfortable just doing what one of the smartest practitioners I know is, most people don't know of him, but he used to be the head trainer for LA Dodgers. He was with the Arizona Diamondbacks. He's the assistant trainer for Chicago Cubs right now, and he has studied every single thing and is one of the smartest guys, but he doesn't care to teach. Now, he has students that, come through the team system every now and then, and young practitioners, and he'll teach them one-on-one, and I guarantee you they'll say the same thing, but and he probably doesn't even post on social media about his family either. But every time something's happening on my end, he'll be like, "Oh, your dogs are doing great." Like, he's paying attention. So, like, not everybody has to um be extroverted, so to speak. And I am in certain ways, absolutely. Um, but I'm also comfortable when I'm not, and I think that's important. I can't remember what your second question was.
Do you ever plan on teaching anything yourself?
Admittedly, I have been more comfortable with Q&As than I am with didactic educating. Now, let's take last decade, for example, presenting at conferences and, assisting at some courses. Um, that's fine when you're a person that always says it depends, because it truly does depend. I don't think that sells. So back in the day, I used to teach for a soft tissue course, and I used to teach for an instrument as an assistant instructor. In the breakout sessions, students would ask questions in clinical pearls and whatnot, and say, "What would you use this for?" And I would say, "Well, I actually don't use it for those scenarios, and I would do this instead with exercise or whatever, something along those lines." And that kind of went against the system that I was teaching for. Because if they're asking me for the soft tissue technique for this given injury, and I'm saying, no, I'm doing something else instead, or conversely, for this instrument assisted soft tissue, I use it on 80% of my patients and I actually don't, then I don't feel comfortable teaching for um, certain systems when that's not all that I do. I would rather someone who uses it 100% teach, and then I'll take what I need from that and then move on to the next. So to answer your question again, I'm more comfortable in indirectly educating through a Q&A like we're doing on this podcast, or if I was up on a panel and um, on stage, and they're asking me a little bit more specific questions than if it were okay, this is the hip, this is how I treat the hip, because it would take all year to get through everything, because every single hip you see is different from the last and from the next. So how can you provide a protocol for that in a teaching setting? At least I don't know how to do that. And I know that there are people who do a good job translating the research to others. Um, that's not my specialty. Um, I enjoy guiding. I enjoy mentoring. I enjoy helping show people show the rope, showing them the ropes. Um, but I found that didactic education I didn't really enjoy as much as I did with a Q&A type of instructing. Or like I did, as you guys first mentioned, on my blog, where I will take one random case throughout the day that just came to mind and I needed to rant on it, and I went on a deep dive, turned it into a blog post, and press publish. So Yeah. I really need to do that again. Um, I have a ton of notes on my phone about different topics, and truly what I end up doing is just starting it and not finishing it. But I don't know,
Maybe
maybe.
this is the spark. Maybe this is the spark.
Yeah. No, I
Start of the pod.
appreciate that. Yeah, I appreciate that. It's just
One last.
everybody. I hate it because okay, I was telling my sorry.
No, you get.
I need to get this off my chest.
Let's
Let's
hear
go
it.
back to social media
Let's hear
because
it.
blog posting has evolved into social media, which now it's starting to come back to, you know, the Medium website and Substack. It's long
Love
form
Substack.
writing is starting to come back, which
Yeah.
I really like. I just haven't gotten around to that yet. But so let's say 15 years, for example, maybe even longer than that, social media was first starting to come out. And like I said earlier, it was so conducive to continue networking with others, learning from others, encouraging others to take other courses, and so on and so forth. For some reason, in the last 5, 6 years, it's flipped to look at me. This is the exercise that you need to do. And now it's evolved to like, this is me dancing to, so come into my clinic. Like, I really do feel bad for not all, but some new grads because it's so easy to get caught up in that. Whereas if we spent more of our energy in R2P, into continuing education, I get it, finances are limited. Um, but I would say if someone starts a blog and they spend a lot of time online, that's their continuing education through doing their own researching, whether it be researching other blogs or researching some social media posts. Because once you start clicking on links, you'll click on their bio, then you click on their link, and you'll realize that oh, they have an online course or something that's downloadable. And um, if they can go back to that, uh, I really do think they don't have to dance as much on social media.
Right off the chest. And I don't know
That's
if you.
just, you know,
Yeah, everyone
no,
listening.
I appreciate that. Like, you know, if anything, that's giving me fuel to do it again because I really did enjoy doing that. Um, Again, I just didn't like forcing it, and
Hmm.
it came to a point where like time time was a little bit limited at times, and then you started thinking like, oh, I need to post, and I just didn't like forcing it. So, um, I do have fuel. Like, do you who Seth Godin is?
No, what's that?
So Seth Godin, he's a person. He's got a whole
Group.
bunch of
Yeah.
books. Let me see. There might be. Sorry, I'm just looking through.
No, you're good.
Um, anyway, he's an author, but he also has a blog post. He posts every day. Sometimes it might be 2 sentences. Sometimes it might be 3 paragraphs. Like I wish I want to get back to that. So the downside is not that I'm doing it for others because truly I've always been posting for myself just to get my thoughts on paper so I can um, learn. And also, here's another thing. I also posted so people can call me out on my bullshit. Like, meaning, like, if someone didn't agree with me and they have a valid point, then I'm learning,
Hmm.
right? So, you don't, what do people do if someone disagrees? You just block them, you delete their, right?
Hmm.
It sucks because that's the reality today.
Hmm.
Um, But yeah, back in the day, if someone truly disagreed with me and left a comment, and it was uh, a well articulated reason, then okay, yeah, great. Like, thank you. I
Hmm.
appreciate that.
I love to see, at least on Instagram, Greg Lehman just go after people, whether it's in the comments or whether on posts. Um,
Sure,
Regardless of what you think, it's pretty cool to
sure.
at least see that at an
Uh,
academic level.
yeah, I mean, I will say though, like I also appreciate when people try to call him out in certain things, because it's a two-way street.
Hmm.
Um, and um, I think so long as it's done in a somewhat of a cordial and professional manner, unlike a few people that don't do it that way, like then because it's sad that some people are hard to listen to, even though they have a lot to offer because of their demeanor, and that's unfortunate,
Hmm.
right? And that's just something I can't get over. If I think someone's an asshole, then I'll just move on, even if they have a good point. Like I just can't.
Fair.
Right.
Yeah.
Um, Richard, do you have any other questions for Dr. Kubos here?
Um, Nothing major, but
So the last thing that we like to do on this podcast is a little quick lightning round of a couple questions. The first question would be, what is your favorite non-clinical book, either being fiction or nonfiction?
When breath becomes air.
Great book.
Or let's
So
see if I
good.
okay, I can't find it somewhere there.
Give a
Yeah.
little quick 10-second synopsis for the people out there.
10 second synopsis is any your life can change in an instant. You could be doing everything right. You can be working towards something truly meaningful, and then you realize that something else matters that much more. So it's a nice book to keep us humble,
Hmm.
I guess you can say.
Hmm.
Yeah.
What is your favorite clinical book or course or any resource? Obviously, you've learned a lot over your years, but if you have one to pick from,
Um,
or
I
maybe even
don't,
recent.
but I have a different answer. My answer would be actually reading books cover to cover,
Mm,
especially textbooks, because well, first of all, in school we never really did. We never really read with intent. We read to memorize. But it wasn't until I actually started reading textbooks cover to cover and realized that a lot of these authors are telling stories. Um, yeah, that really sped things up. But if I were to answer your question, the they're out of the book that really helped me out from a sport medicine standpoint was a textbook by Zach Kazuski. And so he co-wrote with McGee and a few others, uh, sports injury management and the principles of rehabilitation. Like it's a series, and a lot of them are actually from here in Alberta. Um, and so the main point I'm trying to make is those books, read cover to cover, um, were gold. And I guarantee you, like, yeah, there's a lot of resources online, and textbooks are a little bit fewer and far between now. But uh, if you can take a course and finish it from front to back, if you can read a book cover to cover, if you can um, go through a DNS or SFMA and really go down every single rabbit hole you can with those protocols, I think you are doing yourself a big favor by uncovering and turning every single page.
hmm.
So, yeah.
Unreal. If you had another profession that did not involve healthcare or athletics, what would that be?
My answer, my answer was always a butcher
Why?
because I enjoy meat, and I loved anatomy class. I would like sort of anatomy lab. I just remember that like it didn't take me long to go in there without gloves and just go to town. So now when I'm like smoking meat or whatever, I just love the cuts. I know nothing about it, but I just enjoy getting my hands on you know meat and almost like shaping it by taking my time cutting away the fat, the trimmings, and
Art.
and all of that. having said that, I also do also like um connecting with people at like coffee shops or wineries. So yeah, just someone who has like a sommelier or someone
Yeah,
at a winery that just knows the ins and outs of every single wine and like that.
yeah,
And then you're connecting with people, and at the end, like, okay, in our profession, oftentimes people are either in a bad mood, cranky, or in pain. And my next career, whenever that is, if that ever happens, is when people are in good moods. So like hairdressers and nail estheticians, butchers that want to cook something, or coffee shop. Yeah, just switch it up a little bit. You can only be a sponge for so
Yeah.
long.
oh, for sure.
Maybe work on the Bourbon Trail here in Kentucky.
Yeah. Well, for the longest time, like even now, I would say my favorite whiskey is a bourbon, and I even named my dog after bourbon. Um, but I the only downside is I don't drink as much anymore.
Mm. You're on
But
if you're on death row, what's your wine of choice?
bourbon.
Okay.
There you go.
Even better
Like I
choice. All
said,
right.
I name well then again, like I named my dog Bourbon, and my other dog Sauvy for Sauvignon, so maybe that's a problem there.
Well, that's quite fitting considering that you're in
Mm.
Italy.
Yeah.
And then lastly, both maybe in the next 5 or 10 years, where do you see the chiropractic profession as a whole going, and where do you see your own practice?
I see my own practice actually not being much different. Like, so my wife and I have been in practice for, it'll be 20 years this year. And so we've had our clinic for about 17 years. And the trend these days is for big corporations to buy up these clinics like they've done with vet clinics and dentistry. So, you have these big insurance, even like grocery companies buying chiropractic clinics and physiotherapy clinics. And I know that is, we've built up what we call a legacy with our clinic in our community. And um, we are strongly adamant that um, the good things we're on the same page, that we have zero interest in, you know, someone sweeping us off our feet by, cutting us a check. So I can't see my practice being much, much different. If anything, maybe I'll work a few days less so I can be outside doing stuff that I love and want to do a little bit more.
Drinks
Um,
and bourbon.
but per no, no, no. I would say walk my dog or whatever. Um, be in the gym, but no, I can't see practice changing other than maybe me working a day or two less so that I can just do other stuff. Uh, but I mean, you come from a family of chiropractors. Like, it's no secret that there are a lot of people in their 70s still practicing.
Hmm.
So why would my practice change now if people who've been doing it for 40, 50 plus years, they hadn't changed? Like,
Hmm.
what is so different now? So different now. Like, again, going off on a tangent, like people think the world is ending right now, but the world is no different than it was 1,000 years ago, 2,000 years ago, 15,000 years ago. Like, it's all the same stuff, just packaged differently. So where is the profession going? Um, I would answer that by saying I hope it doesn't change too much, because if it does, if it falls into the trap of, again, like selling ourselves on social media, then we're in trouble,
Hmm.
because we have a lot to offer now with what we do, and we always have. So, you know, the you ask a lot of athletes, And I'm not tooting our own horns, but they're looking for the chiro because the chiro is the one that they have had helped them out before. I don't want to say fix them, but like they're the ones who a lot of these athletes have truly trusted and gotten most benefit out of because we are excellent with our hands. It's in our nature to diagnose and not just treat what we feel. We actually have a clinical thought process going on in our heads, um, and we often know about sport and exercise. So I really just I hope it doesn't change too much. Where again the trend um, is a little bit of go towards almost too much towards movement and exercise, and you end up losing hands-on skills. Uh, but if we don't, then I think we'll be in good shape.
Hmm. I think this conversation is really will get students and new grads stoked and excited about going into practice while also keeping them within the bounds of everything that we do. If
Yeah,
people
I
can,
hope
sorry.
so. I hope so. It's just we have a lot to offer, and like um, even in the community, like the sorry, I don't want to interrupt, but even in our community, at least in Alberta here, I can't say the same for the US because I've never practiced there. I can't say the same for most other provinces in Canada because I haven't practiced there. But I know that if someone wants to get better real quick, they're calling the chiro first. And that's a feather in our cap. So we just got to keep that up.
Hmm. Love it. Yeah, thank you so much, Dr. Kubos. Hopefully
Absolutely.
the Oilers can go on a little run here and we'll see you back on the bench and come playoff time. But
Yeah,
thank you for everything. Uh, Talk soon.
my pleasure. I really
Yeah.
appreciate it.
Yeah, thank
Thank
you
you.
very much. It was a great episode.
Thank you.
Perfect.
Sweet.